Massachusetts health officials on Tuesday reported that while there were 358 new cases of COVID-19, hospitalizations have declined 51% from about a month ago. The Berkshires, where in March the first cases of the virus were diagnosed in our region, has also seen some promising developments recently. For context, we spoke once again with Dr. James Lederer, Chief Medical and Quality Officer at Berkshire Health Systems.
From the perspective of the cases that came and went, we're actually at very low levels here in Berkshire County. Our last 5 or 6 days testing has resulted in 0 positive cases per day. So that's not to say it's gone, but clearly the prevalence of COVID-19 in the Berkshire community is markedly lower than it was 3 months ago. More to the point is our experience in the hospital and ambulatory settings has really helped us in knowing, what it is we need to do to be prepared, how to handle patient care, how to anticipate and handle a surge if it were to occur in the future. We've clearly got resources in place. We've been able to rapidly enact and then deconstruct our extra ICU beds and can do that in less than a day. And so we really are much better prepared than we were. From the testing perspective, that's our weak spot still, and that's more a function of the national vendors of the test kits who really, promised more than they could deliver. And so we're still very reliant on the Quest external testing lab to do our tests for us and have very little access to on-site in-house testing. As well, PPE was a problem early on, and while I'm not saying that we have all that we would like, we're much better positioned than we were in the early stages back the 1st of March.
When you look specifically at that personal protective equipment section piece of this issue, we're in the reopening portion of what's happening here in Massachusetts. As you know, we're coming close to what the governor has deemed as phase 2. So that will mean some outdoor dining and some other businesses coming back online. All of these places that are opening up are going to be required to use personal protective equipment. So does that give you concern that perhaps some of the supplies that should be going to medical facilities might be going to help businesses reopen?
We're not really concerned. I think it's degrees of protection. So where most of our high-risk activities are incurred with aerosolizing, producing procedures, such as might be seen with a patient on a ventilator or a patient who's, undergoing anesthesia and some of the intubation procedures that are needed for surgery. Those are the high risk where we need N95s, and it's the N95s that we'd like to have more of and don't have. Surgical masks, I think some of the mask vendors across the world have really ramped up supplies, and surgical masks just don't have the same filtering and protective capabilities as does an N95. But that said, here at Berkshire Main Medical Center, the main campus, all of us are surgical masked, and all of our patients are surgical masked. And in the eyes of the CDC, it portends, it suggests a low-risk exposure. So that's the way we're continuing on with our care. And that's really the recommendations that, the general public are adhering to, so that, were you to go see a play or go out to eat, you're probably still going to have a masking requirement, even though, obviously you can't be masked the full time that you're eating your dinner, but you can be masked, on entrance to to a restaurant or on exiting. And so all of us are going to be for some time, I think, seeing much as we are in town now, the surgical mask requirements and hopefully the compliance by the general public.
That mask piece, the face covering piece in public, which now we absolutely are required to be wearing, and many businesses will have a sign there that says we're not going to serve you unless you have that face covering. Whether to wear a face covering or not is one of the things that changed. At first the CDC said no, then they said yes. What else do you know now that maybe you didn't know at the outset of this?
Well, I think all of this is an ongoing evolution. And so, for instance, when it first came out, there was a suggestion that hydroxychloroquine may be of benefit. It's a drug used to manage the immune response of patients with autoimmune disease. And so, from a philosophic perspective, maybe it would help manage the aberrant immune response in a COVID patient. But it didn't pan out, and much more worse. It was associated with cardiac conduction defects and heart injury. And so, we don't use hydroxychloroquine. When we first started, remdesivir was a drug that had promise, but we didn't know much about it. And so as more of the academic and research centers have had a chance to use it, remdesivir has taken on at least a secondary position as a drug potentially beneficial for COVID patients. So, every day is a learning opportunity. And so I think that's really our challenge, is to make sure that we keep up with all facets of medical education and COVID experience, so that if there is a next time, we're better prepared.
We've seen an uptick in a number of protests lately related to the death of George Floyd in Minneapolis. Some people are wearing masks at those gatherings, but certainly there's not a whole lot of social distancing. As a public health professional, does that give you pause and can give you concern that we're going to see a spike in cases among these people who have gathered at protests?
Well, certainly it does. What the masking experience to date has suggested, and perhaps will bear out in the medical literature, is that if I mask and you mask, when we are in close contact with one another, we're much lower risk to each other were one of us to have COVID. And in the situations we're seeing on TV, there's very, very close contact. And I think, unfortunately, this may be one of those experiments of nature from the pure COVID perspective that will show that if we see a blip up after these events, then it's more proof that the social distancing did work, and we need to be careful, even though the intent of this was to bring light on a horrible situation in Minneapolis and something that should never happen. But we still need to be careful in the day of COVID that we use appropriate guards and appropriate management, so that we don't put ourselves or the people we're next to at risk.
With the eye on being careful, should people who've been at these protests be self-quarantining?
That's just another one of those that that's what we would have recommended if we were in a large group where people were known to be positive. But we're asking people here, while the preponderance of COVID-19 cases are on the marked decline, and people are getting warm weather and bright sunshine and happy to be out of doors, that self-quarantine recommendation becomes harder and harder to be, compliant with or self-compliant with.
As an epidemiologist, you're concerned with research, health policy, obviously getting good information out to the public as you've been doing here. With the eye on research, is there something in particular that you really hope is being researched in a way that you're looking forward to learning more about?
Well, I think what's remarkable, at least for me, is the degree to which COVID infection occurs in asymptomatic or relatively asymptomatic patients. We've always known about minimally symptomatic diseases. For example, my firstborn, a daughter, had chickenpox when she was 5 years old, but she couldn't have had more than 6 chickenpox lesions total, and maybe had fever for a day, but she had chickenpox. And so, we know that exists, but I don't think that we anticipated COVID would have as high a incidence rate of asymptomatic patients. In some studies it's 35%, some are even higher, and that's just a remarkable number when you consider that the other side of that coin is significant medical illness in children, the inflammatory condition that looks like Kawasaki's disease, in the elderly, progressive respiratory failure, and unfortunately, a large number of patients who were on the ventilator and over 65, succumb to the illness. And so you've got these two extremes of a disease, from 35 to 50% asymptomatic to nearly 100% mortal disease in folks who are over age 65, and it's just one of those things that bears more understanding and needs more research to truly get the sense of.
One last question for you here today. As we continue to reopen across the state, what would you like the public to really heed most right now?
I think what we've been doing all along has paid great benefit. That's why I think the Berkshires is in the situation it's in today with, as I said, no positive tests on all the tests we've done for the last 6 days. And it would simply be, where you can, continue to practice social distancing, and as long as you can, continue to use your face covering when you're in more close contact with people around you.